Valves of the heart. Valves keep blood moving forward and prevent backflow. There are two structural types, atrioventricular, AV valves, between atria and ventricles, tricuspid, mitral. Semilunar valves, between ventricles and arteries, pulmonary, aortic, timing in the cardiac cycle. AV valves open in diastole, ventricles relax and fill, and close at the start of systole. Their closure makes S1. Semilunar valves open in systole, ventricles contract and eject, and close at the start of diastole. Their closure makes S2. Atrioventricular AV valves function and key features. General features for both AV valves, located between atrium and ventricle on each side, have leaflets, leafs, cusps, and are anchored by chordae tendineae to papillary muscles in the ventricle. Atrioventricular AV valves function and key features. General features for both AV valves. Those structures prevent valve prolapse into the atrium during systole. Open when atrial pressure greater than ventricular pressure, diastole. Close when ventricular pressure rises, systole. Tricuspid valve, right AV location, between right atrium, right ventricle. Cusps, 3 leaflets, hence tricuspid. Opens in diastole to let venous, deoxygenated blood into right ventricle. Closes in systole to stop backflow into right atrium. Auscultation, left lower sternal border, approximately 4th intercostal space. Clinical notes, tricuspid regurgitation equals holosystolic murmur that often increases with inspiration, Carvalho sign. Common causes, RV dilation, endocarditis, rheumatic disease, less common than mitral. Mitral valve by cuspid and left atrioventricular valve location between left atrium to left ventricle. Cusps, 2 leaflets, anterior and posterior. Opens in diastole, filling of left ventricle, closes at systole. Auscultation, apex left 5th ICS at mid-clavicular line, the apex. Clinical notes, mitral regurg, Owen, holosystolic murmur radiating to axilla, mitral stenosis, diastolic rumbling with opening snap, often from rheumatic fever. Semilunar valves, function and key features. General features for both semilunar valves, between ventricle and great artery, pulmonary artery or aorta. Each normally has 3 cusps, half-moon-shaped, and no chordae tendineae. Open when ventricular pressure greater than arterial pressure, systole. Close when ventricular pressure falls below arterial pressure, start of diastole, closure equals S2. Pulmonary valve location, right ventricle to pulmonary artery to lungs. Cusps, 3, often called anterior, left-right. Auscultation, left 2nd intercostal space, left sternal border. Clinical notes, pulmonary stenosis causes systolic ejection murmur. Physiologic splitting of S2 is due to slightly later pulmonary valve closure, P2, during inspiration. Aortic valve location, arrow left ventricle to aorta to body. Cusps, 3, right coronary, left coronary, non-coronary, posterior. Auscultation, right 2nd intercostal space at sternal border. Clinical notes, aortic stenosis equals harsh systolic crescendo-decrescendo murmur radiating to carotids. Aortic regurgitation equals early diastolic decrescendo murmur. With this may complete with the session. If you liked this video and found it informative, do like, share and subscribe for more such videos. Thank you.